If you're a runner with knee pain, then foam rolling will help a lot more than strength work. Let me explain why. My name's Mark Green. I'm a physio. I've been treating runners for nearly 30 years and I'm a runner myself, competing in everything from 5k to 100 miles. I've also had my fair share of knee problems, so I've had to work out the best way to fix them. Most running related knee pain comes from overuse, which basically means you've done more running over the last few weeks and months than your knee could handle. That builds up cumulative tension and pressure in your knee joint, which eventually tips over into pain. Now this is very different from a traumatic knee injury, like tearing a ligament skiing or getting tackled in footy, but for 90-something% of runners, the knee pain's due to overuse, and for 90-something% of people with an overuse type of pain, you'll get the most benefit from foam rolling. Now if you go to a physio or doctor, you'll often be told you've got a muscle imbalance and you need to strengthen your VMO, which is this little muscle on the inside of your knee. They'll give you squats or leg extensions, or maybe even something like banded crab walks. I'm not saying that strength work is bad for you, but if you've been running enough to bring on an overuse injuries, then weakness isn't your problem. The imbalance in your knee is from using the wrong muscles when you move, not from having a weak VMO. Most people, including most runners, spend too much time sitting. This creates lazy glutes and overactive hip flexors, which in turn means you'll be overusing your lateral quads, which puts a heap of pressure on your knee. I've got another video showing you how to test and activate your glutes so that you know if you're using them properly. I've also got a video on how to diagnose and treat runner's knee. I'll put a link to both of them on the screen, so it's probably a good idea to check those out. Right, let's talk foam rolling. The whole point is to release the tension in your outer quads to help take pressure off your knee. So here's how to do it. Lie on your side, roll up and down slowly, and gradually roll towards the front of your thigh, and stop and spend time on the spots that hurt the most. This is usually excruciating at first, and where most people go wrong is they bail out and stop rolling after about 20 seconds because it hurts too much. You've got to stick it out for 3 or 4 minutes per leg minimum, and do both legs, not just the sore one, otherwise you risk creating a new imbalance. Now if you do this every day, even 2 to 3 times a day if you're keen, for 3 weeks, the pain from the rolling will drop from a 9 out of 10 to maybe a 2 or a 3. It'll still be uncomfortable, but it will be bearable, and the improvement in your knee pain will give you motivation you need to stick with the rolling routine. Once your pain's under control, that's when you should start on some strength and stability work, which is ultimately what will help prevent the knee pain from coming back. I'll link to a 10-minute bodyweight stability exercise routine to help get you started. So if your knee's giving you grief right now, don't waste weeks on clams and crab walks. Get stuck into foam rolling first and add the strength work once you've calmed things down.